Welcome to the vlog, y'all. Today is July 12th. This is the day of my cardiology follow-up appointment with my cardiologist, who I saw almost exactly 2 months ago. I saw him for the first time on May 11th, and I had that appointment with him where he told me that I most likely have dysautonomia, which is the cause of my times where if I stand up, I will feel really faint, lightheaded, feel like my vision's going black or blurring. Sometimes I will fall to the floor because of how dizzy and weak I feel and just not being able to keep walking. Anyway, he attributed all my symptoms of that variety to dysautonomia, and that was informed by the fact that I have low blood pressure a lot of the time, and when I go from seated to standing, my blood pressure gets a lot lower. He does not think that I have the tachycardia piece of it, although in the past several weeks, my heart rates have been bothering me a lot. I have had a lot of times where my heart rate feels really rough in my chest for hours on end. I have had a lot of times where my heart feels like it's surging and beating really fast, and then beating slow and having like skipped beats and double beats. And it's just really been bothering me the past couple of weeks. I don't think he'll be very concerned about that because we did a bunch of testing. So I had an EKG in his office when I initially saw him 2 months ago. And then I also had a Holter monitor, 24-hour Holter monitor test, and I had a echocardiogram, and all of that stuff came back normal. So I don't think he'll be too concerned about this. So I'm trying not to worry about the fact that my heartbeat bothers me a lot and just hoping that it's a normal level of weirdness. But at the same time, this is a new thing. It's not like my heartbeat has always felt rough in my chest and like mildly painful and bothered me. It's just in the past several months that this has been occurring and been bothering me. But I mean, if he says it's fine, then I assume it's fine. Yeah, I've been drinking salt water to manage the dysautonomia per his recommendation. That has helped with the amount of lightheadedness, headaches, blurred vision, fainting episodes that I've been having. It has reduced those a lot, so that is good. He also did some blood testing on me, which I briefly talked about in my last video on cardiology. I didn't really understand the blood test results because the blood test was not nutrients. There were a few nutrients that he tested in my blood, but it was mostly like serums and hormones and blood cell counts, and I do not know how to interpret those. So that is what I'm interested in him explaining to me today. I don't know. At this appointment, what I'm hoping to get out of it is there's a lot I want to tell him about my family history and my past history with symptoms that I've been thinking about that I think are relevant to the dysautonomia thing. For example, the fact that my grandmother has a POTS diagnosis that I found out after I saw the cardiologist this past time. My grandmother on my mother's side. There's a lot of stuff on my mother's side that I've been finding out overlaps with my conditions, and some family history stuff there that's informing my thoughts about what the root cause of all my conditions might be. Just saying that it is from my mother's side, which I suspected about a year ago. I was like, hey mom, I know you don't have GI issues, but like all the joint problems that I have, I feel like they're from your side. And now we're finding out the heart issues are also from her side. And I'm just like, mom, you brought this upon me. I love my mom though, she's great. I just want to say that I called it. But anyways, found out that my grandma has POTS. Then I also just have been thinking about my past and the fact that my whole life I have never really sweated. Like I will sweat if I get extremely hot, but even then I won't always sweat. Robert and I have been going for daily walks in the heat. I will get so overheated that I get irritated and angry and just like weak and just feel terrible on these walks in the heat, but I won't sweat, which apparently is like a dysautonomia thing. So I want to tell him about that. And I've also just been thinking about how my whole childhood I hated being in the heat because I don't sweat. Been thinking about the fact that when I was a kid, I had an EpiPen because I would have these episodes of getting really sick in the heat. And so everyone thought that I was allergic to something outside, even though they never found an allergy outside that I was actually allergic to. So I want to tell them about that. And I want to tell them obviously that my heartbeat. It's not really the rate, it's like the beat is just bothering me. It feels like a fish in my chest. I don't know. It's probably normal, but it just feels like a fish in my chest. And it feels like it's like knocking the wind out of me. Not every day, but sometimes it is every day, and they're like episodes of it doing this, and then it goes away. I don't know, it's just so weird. So maybe he'll care about that, maybe he won't. The other critical thing to get out of this appointment is to figure out if we're going to look for an official dysautonomia diagnosis or if we're going to be satisfied with the theory that it's dysautonomia. There are a lot of different types of dysautonomia. I feel like POTS gets talked about the most these days, but there are at least 13 to 20 different known types of dysautonomia, and they all manifest differently and have different symptoms and things like that, different potential causes. And so I don't know if I'm going to ask him to refer me to a dysautonomia specialist or not to do further testing. There are 2 dysautonomia specialists in our area. There is one at UNC and there's one at Duke. So they're both in the triangle. I have a friend of mine who got diagnosed with POTS at the beginning of the year, like in January or February. He got a referral to the UNC dysautonomia specialist, and his appointment was booked a year out from when he requested it. So he was diagnosed with POTS in January of this year. He's not seeing the specialist until January of 2024. So a full year wait. I don't know what the deal is with the Duke dysautonomia specialist, how far out she is booked, but I would venture to guess that it's also booked out super far. So if I want to see a dysautonomia specialist to get an official diagnosis and tests like a tilt table test or a stress test or a sweat test, because they use all those things to diagnose dysautonomia and to figure out what kind of dysautonomia that you have. If I want to go forward with those tests and get that referral, it's not going to be like I get an answer soon. It will probably be 2024 that we get these answers. So this is probably going to be the last cardio update for a while, unless my cardiologist wants to order any additional tests himself. But I am very excited for this appointment because I just like my cardiologist. If you watched my last cardiology video where I talk about the process of getting all these tests done and the appointment that I had with him in May and all that, I'll link it below. As I mentioned in my last video, this guy is the nicest to me of all the doctors that I've had and seen. I just personally like him a lot, and I am excited to see him. Just to see a doctor that is nice to me and who will be affirming and who wouldn't judge me if I cried. And honestly, given how I've been feeling lately, just how down I've been feeling lately about my physical health issues, I honestly might just need someone to talk to and just someone to be nice to me. My appointment isn't until 3. I worked this morning, but I just got home like a little bit ago. So we will be leaving here in exactly 2 hours, and we'll get this appointment done. Welcome to the vlog, y'all. It has been over 2 weeks since my cardiology appointment. And normally I film my doctor's office recaps right away, but I needed some time to take in the cardiology appointment. And I also wanted to get all of my follow-up appointments set up before I made this video so that I could tell you guys when my follow-up appointments were, because the main outcome of the cardiology appointment was that I have 3 referrals to all different specialists for different evaluations and testing. I love my cardiologist. He is the only doctor that I've seen in this entire journey who wants to help me look deeper for the root cause of my symptoms. He believes that there is a root cause, not only of the GI stuff, but also of the dysautonomia. He wants to help me find it. He is very serious about investigating. Something that we really connect on is the fact that his daughter has POTS, and so he knows a ton about POTS, but additionally, he also knows a lot about other rare illnesses that can be connected to dysautonomia because they're trying to find, them as in him and his wife, are trying to find the root cause of his daughter's dysautonomia. So they're looking into the genetics of their family, they're calling family members to get family medical histories, and a lot of the same stuff that I've been doing in my journey. I have learned a lot about my family's medical history from sharing my own experience, and people have reached out to me or my parents have asked questions, and I've learned a lot that I didn't know prior to this journey. And he's having the same experience talking to him and his wife's family about their history and his daughter. So he's on a similar journey to me in the context of helping his daughter. So it definitely makes him really interested in root causes and really interested in the complexity of illness. One thing that he said to me that really stuck with me, one of many things that he said to me that really stuck with me, was I can understand why your gastroenterologists, all 3 that I've seen in the past couple of years, I can see why why your gastroenterologists have been so dismissive and just generally unwilling to make a clear diagnosis or to get to the bottom of things, and that's because you're a complex case, and getting to the bottom of what's happening with you is going to be more than what a gastroenterologist alone can do. If you clearly have some sort of illness going on that is beyond your gastrointestinal system, that is even beyond dysautonomia, it's probably something bigger, and it's going to require seeing a lot of specialists and just people working together, and doctors want to be able to treat a patient within their own specialty and to treat and cure a patient or at least significantly improve them. And in a case like mine, gastroenterology is, we know now, a piece of what's going on, but definitely not all of it. Gastroenterology is not going to be the one to cure me, even if they could do more for me than what they've done. So he talked to me about that very openly, and I appreciated it. And he was very humble. He was very, he readily admitted, that he could only do so much to help me, but he truly wants to do everything he can to help me. I have heard from many people in the chronic illness community that in some cases it can be hard to get cardiologists to do a lot for dysautonomia, or to get cardiologists to even believe or take dysautonomia seriously. And I'm really lucky that for the first time in my journey, my cardiologist takes my symptoms more seriously than I take my symptoms, quite honestly. Like, for me, dysautonomia does cause discomfort in the heat, weakness, fatigue, headaches. It can cause nausea at times. Like, it does cause me issues, but my stomach and intestinal problems are such larger focuses for me that the dysautonomia is kind of in the back of my mind most of the time, rather than something that I'm like, thinking about all the time, the way the GI stuff is. And it really is such a relief to have a doctor care about my symptoms enough to take them more seriously than I do. What a blessing, because I have felt for years that I've had to plead and beg and convince doctors that my symptoms are serious. And finally, my cardiologist takes my symptoms way more seriously than I do, and he's like, here's all the things I can do to help you, let me help you. One of the things that I was worried about at the appointment was, would I have to push him to give me a referral to get an official dysautonomia diagnosis? I didn't have to push him for anything. He initiated everything. We had a lovely conversation. It was just so great. Let me get into more specifics, because there are specifics. I'm going to use my phone because I want to tell you exact dates of appointments, and I just don't have that in my memory right now. I also need to log into my Duke MyChart account and push back my blood work appointment. He loves giving me blood work. Like, I have been wanting GI to do blood work for so long, and he has just ordered the second round of blood work that he wants to do on me. Like, he takes this so seriously. It is so wonderful. I was feeling so down, and coming out of that cardiology appointment, I felt so affirmed, so happy, so listened to. Now, 2.5 weeks later, I've kind of come back down to earth, and I see that, as affirming as he was, as helpful as he was, I'm still living with the issues that I'm living with, and he didn't cure them, but it was really nice to be in that space where I was being listened to and taken so seriously and so affirmed. That was just a lovely appointment that I had, and he spends such a long time with his patients. He was late to our appointment by 30 minutes, but he didn't cut the appointment short because of that, and I didn't mind that he was late because I knew that he was spending a long time and heeding to another patient. Then when he was with me, he gave me that same respect, and he was with me for an hour then, so I'm sure he was just late the rest of the day because he just cares so much, and he never compromises his care. I think I need to reschedule this. So I wanted to reschedule my blood work, but I think I've missed the window for rescheduling an appointment, even though this appointment's several days from now. And I've also missed the window for rescheduling it online, so now I have to call them to reschedule it. This appointment is 3 days from now, and it's just for blood work. Why did I procrastinate this? I knew I wanted to reschedule this blood work for a while. Why did I do this to myself? Well, I'll just have to call Duke first thing tomorrow morning. We'll get to why I want to reschedule in a second. I have 4 appointments with the Duke lined up right now. I'm getting overwhelmed just looking at everything, and I'm grateful for it. All right, so let's start with the blood work since I'm going on about that. The cardiologist and I did review all of my test results. We did talk about all of my concerns. My rough heartbeat that has been bothering me on and off for several months, where I'll go through, weeks or more where I have hours in the day where my heartbeat is really bothering me and beating rough in my chest, and just all the stuff I explained at the beginning of the video. So I explained that to the cardiologist, and I was honestly kind of scared to tell him about it because the test came back essentially normal. So I was scared to be like, I'm still worried about this thing with my heartbeat. And then when I explained it to him, he was like, no, it totally totally makes sense why you would still be concerned about this, and here is probably what is happening. So we drew like a diagram of my heart, and we talked about the pacemakers, and basically he just thinks that at certain times, I guess the heart has multiple pacemakers, but one normally kind of guides things, and at times, I don't know that much about cardiology, so excuse me if this is not getting explained right, but basically he said that it has something to do with the pacemaking of the heart, and the pacemaking can get a different beat going if multiple pacemaking things are competing with each other or something, but he said that it's normal. So he was like, yes, it's irregular, yes, it's uncomfortable in your chest, but it is normal. He said that there are people who have heartbeats that are all over the place to a much larger extent than what I have experienced, and he said that they still are considered normal and it's not like dire or anything like that. So basically, he listened to me, he affirmed that he got why I was concerned about it, he did not dismiss my concerns, but he said that it's normal. So my heart is just not doing as well at keeping consistent pace as it used to, basically. But it's not a cause for concern, it's not a cause for emergency, if that makes sense. So we talked about that. Then we discussed the fact that the salt hasn't felt like it's been working as well in terms of a lot of things, and the fact that I struggle to get enough salt because of my water consumption issues, and I put my salt in the water. So we discussed that. Something that came up when we talked about my blood work was everything looked pretty normal except for two things. So I'm really close to being anemic because my hemoglobin is right on the edge of being anemic, but he said that it wasn't enough to worry about. Like, he's not worried about it. So we didn't go into that too deeply. But there was one thing that he tested that was way lower than it's supposed to be, abysmally low. And that is my aldosterone. What is aldosterone? Aldosterone is a hormone that helps regulate your blood pressure by managing the levels of sodium, salt, and potassium in your blood and impacting blood volume. Having too much or too little aldosterone in your body can cause health issues. So as you know, I have problems with my blood pressure being too low. It signals certain organs like your kidneys and your colon to increase the amount of sodium they send into your bloodstream or the amount of potassium released in your urine. Aldosterone's effect on sodium increase causes your body to retain water in your blood, which increases blood volume. Oh, low aldosterone symptoms are all things that I experience. So I'm looking at this article from the Cleveland Clinic on aldosterone. Low blood pressure, muscle weakness, nausea, heart palpitations, and irregular heartbeat. That is what I was just talking about, that I have a regular heartbeat now. Oh my gosh. Nausea, heart palpitations. Yes, these are all of my symptoms. So I have low aldosterone. He said it was super low. He said it was a lot lower than it should be. And he had almost never seen it that low before. For that reason, he gave me the first of 3 referrals. He referred me to an endocrinologist because aldosterone is a hormone, so he wants the endocrinologist to look into why my aldosterone is low. My endocrinology appointment is actually my soonest specialist appointment coming up. That is going to be on November 16th, 2023. And it was funny because they apologized when they told me it was going to be in November, and I was like, that was way sooner than I was expecting because my other referrals are in 2024 by a lot. The endocrinologist is going to see me and look into my low aldosterone and potentially other hormones, I don't know, on November 16th. I also have a follow-up cardiology appointment on the 29th of September. I did not expect my cardiologist to want to follow up, but he did prescribe me a new medication, so he wants to follow up to see how that's working. And that's also why he ordered the blood work. He prescribed me this medication called Fludrocortisone. So basically, it is a medication that will help my body to retain more sodium. It should help increase my blood pressure. The problem is that it has the potential for a lot of crazy side effects. It also causes the body to get rid of more potassium and I believe more chloride. I'm gonna look this up too. So it's used to treat Addison's disease, which I don't think that I have. It's considered first or second line pharmacological therapy for orthostatic hypotension. It is a steroid, which it may take 2 to 4 weeks to start to work. All I know is, I feel like I'm starting to confuse things, but all I know is it can cause a lot of crazy side effects, okay? It can deplete the amount of potassium in the body to a level that could potentially be bad. Potentially, I think calcium as well. Because of that, he wants me to take it for several weeks and then get blood work done. However, I have been nervous to take it because the list of side effects is super, super long. I just started taking it 2 days ago. That's why I'm trying to push the blood work back because the blood work work was supposed to be done this upcoming Wednesday, but given that this whole situation is happening where I was too nervous to take it because of the crazy side effects and just afraid of depleting my potassium and all this stuff. So because of that, I didn't take it like I should have. So the blood work will basically be a wash if I get the blood work done and I haven't taken the medication. So that's why I need to push the blood work back. So I'm gonna push the blood work back to probably really close to my follow-up cardiology appointment. I'm probably gonna push the blood work back to maybe a week before my cardiology appointment, because my cardiology appointment is September 29th. I'll probably push it back really close because that way it'll give me the max amount of time on the Fludrocortisone. That'll probably be best. My cardiologist wanted to make sure that I got enough of this medication if it helps me, so he gave me 11 refills on it because he's a homie. I won't have any problem getting more prior to my follow-up appointment, so that's not a big deal if it does help. That's update on that. Getting back to the other referrals, like I said before, I did not have to push my cardiologist at all to getting me a referral to a cardio electrophysiologist. Linneo, what is a cardio electrophysiologist? I don't actually know, but they're the ones that can actually test for and diagnose dysautonomia. They basically specialize in dysautonomia. I think in other things as well. My cardiologist is not going to really test me for dysautonomia. He's not going to officially diagnose you with it. This person, the cardio electrophysiologist, is going to do all that with me. So I know that a lot of times for dysautonomia, they will do a sweat test, a stress test, a tilt table test, any of those things. If anyone's going to order those tests, it's not going to be my cardiologist. It will be this cardio electrophysiologist. Now, as I said at the start of the video, the people that do this kind of work in the triangle where I live are extremely booked out. My cardio electrophysiology appointment is not until September 3rd of 2024. We're getting into what I've been saying for a while, which is we're getting to the point where I'm not going to get any definitive answers for over a year. So we're going to have suspected dysautonomia going on for a while, and we're not going to have it confirmed or any testing done until the later half of 2024. Now, I'm fine with that. My cardiologist is taking very good care of me. He's clearly doing everything he can. He's looking into the hormone piece. He's given me a medication to try to help me maintain my salt and retain my salt, since I can only eat so much salt. I can't just salt load the way a person without my GI issues could. So he's given me this salt retaining medication that I don't think is offered to everyone that has my issues. I really, really appreciate everything that he's doing for me. And so because he is so supportive and because he's so good and because he's so knowledgeable about dysautonomia, and he seems to continue to want to follow up with me and keep making my life better, which I've never experienced from gastroenterology. It's a whole new world to have someone who just wants to actually help make my life better in whatever way he can. This is a totally new experience. So due to the fact that he's put me in very good hands, I'm really not concerned about the fact that I have to wait over a year to see the cardio electrophysiologist, because I'm in good hands with him. Symptoms are valid even without a diagnosis. That is 100% clear to me, especially with rare illnesses and illnesses that are poorly understood and illnesses that are complex and illnesses that are hard to diagnose, which are all the things that I'm experiencing. So I'm okay with waiting on an official diagnosis. It is okay with me as far as the dysautonomia piece goes. But I know there are those of you who want to know if I'm going to get an official diagnosis, so there you go. There is your answer. Now, getting to the final referral. This is where my cardiologist is really trying to help me get to the root cause of everything that is going on. So there are multiple kind of potential root causes for my GI issues and my dysautonomia, and the fact that there is potentially one root cause causing me to have both of these conditions or all of these conditions or whatever. My cardiologist and I talked about autoimmune causes, and we also talked about potential other types of diseases that could be causing it. I don't want to name names right now because I just don't want to get into it right now, but I will say that my cardiologist agrees with some of the things that I've been thinking about in terms of a potential root cause for my conditions. So that was also affirming, the fact that he agrees with me about some of the stuff that I've been thinking about for a root cause. And he's also been looking into similar things for his daughter. So he's aware there are criteria and symptoms of illnesses that I don't think most doctors would be so up to date on. Like, I'm sure they've learned about it in medical school at some point years ago, but my cardiologist is very up to date on current research about illnesses that could cause someone to have the GI issues that I have and the dysautonomia that I have. So I'll leave it at that. But he agrees with me, and it's actually in my chart that he agrees with me about it. It's kind of interesting to see that in my chart. Because of that, him wanting to find a root cause, he has referred me to a rheumatologist. That appointment was originally in January, but then they called me and pushed it back. Now that appointment is March 20th, 2024. Like I've been saying, further answers are going to come in time, but it's going to be a lot of time. March 20th, 2024 is when I'm seeing the rheumatologist. The particular rheumatologist that I'm seeing is an eye specialist. He specializes in autoimmune eye diseases. That is what his research is in. I'm not super hopeful that he's going to be able to help me a whole lot with an autoimmune cause for my dysautonomia or a potential other rheumatological cause for my dysautonomia and GI issues. I'm not hopeful about that. It's at least a rheumatologist. I have to have faith that he's knowledgeable about a lot of things related to rheumatology aside from what he studies. But given that he specializes in eyes, I would just, I would feel better if he specialized in something that was closer to what I was experiencing. That's all. I wish. He's a rheumatologist. I'm sure that he knows a lot about other rheumatological issues like joint pain, which I do experience. My joint pain has gotten so much worse lately, like the pain in my jaws, the pain in my knees, the pain in my ankles, pain all over the place. Honestly, by March 20th, 2024, I might have something that feels more classically rheumatological to talk to him about. Like, hey, I have all this joint pain. Maybe he can look into that as well. But the more that I learn, I'm like, why do I have so much joint pain at 27? Really, why? My jaw pain has been really, really bad lately. The pain in my lower body flares when I do physical activity, but my joint pain just kind of flares just existing. Even just talking too much, my jaw will hurt. Eating, my jaw hurts. My jaw just hurts all the time. That's my biggest issue. Also, the pain in my lower body, I've been living with it for so long that it doesn't really bother me as much. I just expect that I'm always going to be in some sort of pain in my lower body, even if I'm just sitting or something. But pain in my jaw is more new. And it's like, I'm not like conditioned to this yet. That is something that I could talk to the rheumatologist about, I guess. So we'll see. But yeah, this got way longer than I meant it to. That is the cardiologist update. Again, I could not be more grateful to him. I feel like he is the only doctor who is actually moving the needle forward in terms of trying to get me actual help and actual root cause diagnoses and actually better quality of life. Whereas my gastroenterologists basically just hope I don't text them or, mess them on my chart or whatever. Like, I'm pretty sure my gastroenterologists just hope they don't hear from me again. Whereas my cardiologist genuinely cares. So that's very nice. Anyway, thank you for watching. I will talk to you in the next video.